Hey everyone, we're the Note Ninjas. I'm Nicole, the occupational therapist, and this is Stephanie, the physical therapist. Today we're going to be showing you some seated core exercises for strengthening, for stability, sitting balance. So we love working on seated core exercises, especially for the older adult. You could do these on a bench table, on a mat table, the edge of a bed, in a chair, in a wheelchair. There's so many variations. So all you need is a ball and a chair, some type of surface. Okay, and Stephanie's going to be demonstrating some of these exercises. So first, what we're going to be doing is a seated leg lift with the ball. So the ball is going to tap the leg. Yes, and we're using the core. So some things that you want to be making sure the patient is doing is sitting up nice and tall. Their posture is good. We really want to focus on engaging the core muscles. Okay, so this is a little bit of a more of a sequence where we're lifting the legs, we're tapping the ball, we're engaging the core. So we want to make sure that we're cueing the patient properly on the technique, on proper muscle activation. Okay, she's even getting some oblique activation right there too. The next one is just a trunk rotation, core rotation. Now, this one's really important too because once again, all these exercises, you need to be cueing properly in order for the patient to be properly activating their muscles. So the patient could just take the ball and go just quick and not be activating anything. Maybe they're getting endurance, but they're not activating the muscles. So we want to make sure that we're cueing. Maybe I'm going to put my hand here. I want Stephanie to tap. Okay. That way she's getting a little bit more rotation. She's working on the abdomen. Okay. We can cue with head turns, things like that, making sure she's sitting. I know a lot of patients tend to lean back in their chair during this one if they're supported. So we really want to make sure that they're scooting towards the edge of the chair, sitting unsupported, and once again, activating the whole core. The core is a large area, okay? It's in the front, the sides, the back. So we want to make sure that the whole core is being activated. The next one is just a reach forward. Once again, this is one that you need to make sure there is proper cueing. The patient is doing it right. So we don't want to just, all right, here, reach forward with the ball, walk away. Well, first of all, that's not skilled. They're doing it independently. So this one, in order to show our skill, I like to, you can put a target in front of them, or I can just simply come here, tap my hand. Good. Okay, making sure that she's reaching properly in order to engage and activate those core muscles. Beautiful. Okay, we want to make sure the back is straight, that there's no arch in the back, okay, that the feet are stable. So some of our older adults may compensate and shift their feet around. Once again, lean backwards on the chair. We want to make sure that none of that is happening. So you might be using verbal cues or a visual cue, some tactile, and then even maybe some physical assist if they need to reach forward more. Okay, so we're guiding them. See, are you use the muscles, and then we're using tactile cues to get that abdomen, make sure that it's tight and it's activated. Wonderful. Okay, next one we're going to be doing is a wood chop. So you could call this anything you want, a diagonal chop, a wood chop. So we're going to start one side, bring it down to the other. Awesome oblique exercise for the older adult. This is really great for any type of functional reaching that you're doing with your patient. For if you have a dressing goal, these are good ones to add in. Okay, there's so many motions, the range of motion. So once again, you want to maybe put a tactile cue, verbal cue, or visual cue up here to reach towards, and then chop down. Okay, activate the chop. You could cue on pacing as well. So maybe if they're doing it, once again, if they're doing it too fast, then they might not be activating. Are you activating any muscles? No. Okay, maybe once again, you're working up your endurance, your cardiovascular, but you're probably not activating your core muscles very well. Maybe eventually over time, they will start to burn, but we want to make sure that we're going slowly, okay? And you really feel it in your obliques. Amazing. So you're lengthening and then contracting. All right. So we love these exercises. We love doing seated core exercises with our patients, especially for our older adults. Once again, they can be modified, but really you need to focus on the skill that you are providing as a therapist. So I walked you through a lot of the cues that we could be giving and the guidance that we could be giving with our patients. Skilled techniques in order to make it skilled. You can change their positioning. You can use different intervals, do interval training if you want to add in that endurance. But once again, if you're going to be adding in endurance, make sure that they're still doing the full range of motion. They're still doing the technique in order to engage the core. Okay. So, in order to find more skilled techniques, documentation tips, make sure to subscribe and like our page. We are the Note Ninjas.